as we all know, everyone's desire is to live healthy. To live healthy, it is very important to keep our important organs in the body healthy, like heart and the brain and other important organs. So, the very most popular and the dangerous and the safest organ to be kept safe all the time is the heart. Therefore, keeping healthy heart plays a vital role for anybody's in their life. So, for this reason why now there is a lot of debates and the controversies and the discussions going on how to keep the heart healthy. That is where now the discussion of question of heart attack comes. The heart attack, as we all know, is basically when there is an issue with the blood supply to the heart, or when there is a hampering or when there is an obstruction to the blood flow to the heart, it produces a heart attack in the form of chest pain. So, the moment I say chest pain, everybody thinks that all chest pains are because of heart attack. Absolutely, it is not the case. The heart pain or the heart attack pain comes in the chest, it does not mean all the chest pains are heart attack. But to identify how to identify the heart attack, number one is it should be in the center of the chest. The pain location should be in the center of the chest, and it should be at least 5 to 10 minutes duration, and it should have an associated features like increased perspiration in the form of sweating and sometimes radiation to the left arm. So, identifying all these symptoms is very crucial to understand whether it is a chest pain leading to the heart attack or something like a non-chest pain, because of very 100 reasons for that. So, when sometimes people question us, is there a possibility of healthy people dying suddenly with the heart attack? Yes, the answer is yes. The reason is, since we are not being periodically checked up, the heart attack can manifest suddenly first time in anybody's life. Therefore, the question of periodical checkups come. Then the heart risk factors, how to identify these risk factors. Somebody is having a chronic smoking, somebody is having a family history of heart disease, somebody is having a diabetes, hypertension, high cholesterol, just sedentary lifestyle, not being exercised, or increased BMI. All these things are very notorious risk factors. So, to prevent all these things, to manage all these things is the secret of success in keeping the heart healthy. Then the question of, suppose if an individual gets a heart attack, how to live a normal life? Is it possible? Yes, the answer is yes, it is possible to live a healthy life provided heart attack is managed properly. Properly in the sense, it should be attended in a timely frame, in a specified timely frame, and it should be treated with either if there is a block, it should be treated with a revascularization like a stenting or a bypass. So, somebody is having a good heart function even after the heart attack. If there is a revascularization done in the form of either stenting or the bypass, they can definitely lead a normal life. So, for this, an individual needs a periodical medical checkups and periodical examination and regular medication, regular exercise, dietary habits and management of risk factors, very important, like diabetes, hypertension, dyslipidemia. As I was telling, to prevent heart attack is very important to keep the community or the society healthy. To prevent heart attack, the secrets are: number one, to manage diabetes, to manage hypertension, to manage dyslipidemia, and to not to smoke. Very important. Smoking is dangerous to the heart, is the number one enemy, I can say. And another very important enemy to the heart, as I was telling, is the stress. Very important now in younger generation, more so in Asian population and even in India. So, the stress, unnecessary stress, probably is keeping many people's heart at stake. So, therefore, manage the stress, manage diabetes, manage hypertension, manage dyslipidemia quit smoking if at all somebody is smoking. So these are the very, very important things. And another important lifestyle modification one has to do is like walk every day, at least 4 to 5 days a week is specifically mentioned, but it is for our for our routine thing, better to make it as a walk every day, at least 45 minutes. There are some specifications to walk, like we have to walk on a level ground at least 45 minutes a day with a maximum possible one's own pace or speed. That is very important. A casual walk is not useful. A good brisk walk is useful. The speed should be at somebody's maximum possible pace. So these are the things that are very important in walking. And in the dietary habits, many people have a question of how to maintain a diet. You see, it is not the vegetarian or the non-vegetarian that is important. It is the oil content that we consume per month is important. The oil consumption should not be more than half liter per month per head on average. So if you maintain that type of quantity of the oil, it is useful. And there are many oils specified, including the sunflower oil and the sunflower oil combination with the groundnut oil, then rice bran oil and the olive oil. There are many oils mentioned, but generally, one need not go all the time for an olive oil, which is costlier for an Indian population at least. But whatever the oil we consume, if we consume less than an half liter per day, we are in a safe zone. And as I was telling, important thing is the treatment of diabetes, hypertension, dyslipidemias. For that, we need a regular medication without missing a single day. That should be the dictum. This is something called a military discipline should be imposed one's own self to continue the medication. Therefore, we can lead a normal life even after the heart attack. To prevent heart attack, as I was telling, we have to manage the risk factors, we have to avoid the risk factors. And the important risk factor most of us neglect is a sudden death among the parents. Suppose one of the parents or both the parents suddenly die at the age of 40, 50, then that next generation, like next siblings, the generation people will have definitely there is a threat on the heart. These people should be identified promptly, appropriately, and they should undergo a periodical medical checkups, including the treadmill test, which gives a good, meaningful, conclusive information whether somebody is having a risk of heart attack or no risk of heart attack. This is very important. So I will reinforce, one is we have to move for health, that too for a heart, and we have to maintain a good healthy diet pattern, and we have to get a proper periodical medical checkups to maintain the healthy heart. Thank you.